Time management in hydrogen antioxidation infusion therapy, a new method. The results of hydrogen and nutraceuticals infusion gives excellent results, and word of mouth soon increases the patient burden. The actual time taken for one infusion in a patient often exceeds 40 to 45 minutes. Thus, if one gets 10 patients, the total time to add the antioxidants, prime the diffusion set, hang it, give an IV, and transfuse is about 45 minutes, and thus for 10 patients will become 450 minutes or 8 working hours. In these modern times, when the time is premium both for the patient and the treating clinician, unless the center has 5 or 6 machines, one cannot speed up the process. This short video demonstrates my efforts in time management in the procedure, as 300 ml per minute of hydrogen bubbling in a 500 ml antioxidant bottle is enough. Using a Y connector, we can simultaneously give 2 patients at the same time, thereby halving the time needed. Formula for cocktail use: 1.2 grams of glutathione, 2 grams of vitamin C, 1 ampule of vitamin B12, 1 ampule of polybion of vitamin B complex, and 300 ml of molecular hydrogen infusion. The procedure of video is shown herewith. This is a demonstration of how dual hydrogen infusion is administered. First, we take vitamin B complex and vitamin B12 in a syringe. The same is now injected into the saline solution. The next step is taking vitamin B12, 1 ampule, which is now extracted and inserted into the saline bottle. Next is the transfusion set. We have already added glutathione and vitamin C. So the first bottle is ready. It is hung on the stand and primed with a needle on the top to allow for hydrogen to escape. In a similar manner, the second bottle is also ready. So 2 bottles are ready. Now we have to connect a Y connector and attach the two transfusion sets to the hydrogen machine, so that the 600 ml of hydrogen exiting from the machine is bubbled simultaneously through the bottles together. As instructed previously, we can push the two together and let it bubble for about 5 minutes, after which we can begin the transfusion. This way, 2 bottles or 2 patients can benefit from hydrogen and nutraceuticals simultaneously, thereby halving the time needed for each perfusion or transfusion. You can see the Y connector from the hydrogen machine connected to the 2 tubes, both of which are simultaneously bubbling molecular hydrogen into the nutraceuticals and vitamins, nutrition, antioxidant solutions hung by two bottles for our procedure. So, in this way, we can use 300 ml each of hydrogen bubbling simultaneously. I hope the procedure is clear and self-explanatory. If you are interested in learning more about molecular hydrogen, its therapeutic effects, its uses, the caution needed with use of hydrogen, one must do an IAOS hydrogen therapy course and get a medical infusible hydrogen machine for your regular use. So once the transfusion is given, the butterfly is removed, sterile gauze piece is put, and the connectors are disconnected from the machine. For further details, you can send me a WhatsApp message on the number which comes subsequently in this lecture. I hope this is clear. Thank you very, very much for your kind attention. Thank you.